So welcome to this week's video newsletter. This week I want to talk about something that a few people have been asking about through Secrets Recovery, the community site, and I think there may have been a comment up to on the blog, around pacing and how to know when to push and when not to push. Often it's very difficult when we're on the recovery path, knowing how much we should or shouldn't be doing. Because many of us will have had the experience of resting and feeling better, and resting and feeling worse. So for example, going for a rest period of depending on our situation, a few days or a few weeks or whatever, and feeling significantly improved through doing that. And other times we do that and we just start to feel we're not sleeping as well, we start to maybe get more symptoms, and so resting doesn't seem to help. Many people have also had experiences of pushing themselves to do a little bit more than they thought they could do, and actually feeling better. That you feel better for what you're doing, you feel kind of a sense of a psychological lift, I guess. And some of the anxiety patterns about doing things will tend to go away. But people have often also had experiences of pushing themselves to do more and then having a relapse. And I'm sure you're aware that these kinds of not being clear of when to push, when not to push, what we can do, what we can't do, is a massive cause of anxiety on the recovery path. So hopefully you're already doing some work on the psychology side around this, around calming down those patterns in the system, because obviously makes a massive difference. But a useful way of thinking about this is something that we came up with a few years ago that we call bouncing the boundaries. And what we mean by that is, if that's, for example, the boundary of how much you're able to do, what a lot of people will tend to do is to go from that to that. So they'll push themselves to do a lot more, and then they'll tend to feel worse doing it. Or they'll feel better for a few days, and then, for example, if they've got mitochondrial issues, the mitochondria will run out and they'll then crash. All people will tend to do is to have a very rigid boundary, where they don't want to push themselves, don't want to risk doing more in case it makes them feel worse. And what we noticed was, what seemed to be working really well with patients was this idea of firstly setting a clear baseline. And what I mean by a clear baseline is a level where even on a bad day, you know you can do your standard routines. Be that having certain amounts of work you do in a day if you're able to do that, certain amount of rest, meditation, or psychology, other stuff that you're doing. But you've got a kind of basic level that you know you're okay at. So then if you do overdo it slightly, you've got that as almost a comfort zone to come back to. And it may be if that's your basic level and you have a bad day, you drop to there, but you know that in a day or two you come back to that level again. Once you've got that in place, what you then want to be looking at doing is gently expanding that. Now, that's only appropriate if you've got to the point where you've stabilised and you're doing treatments that are gradually increasing your energy. This is in some ways, we'll come to in a moment how it's different, but in some ways similar to pacing. But as you may know, my perspective, also the clinic perspective around pacing, is it has its place at a certain stage of recovery. If someone's in the crash and burn stage, what we call stage 1, pacing and then graded exercise is the worst thing you can possibly do. Because at that point you need as much rest as you can. Pacing is only helpful if you're limiting your activity, but trying to increase your activity at that point is completely inappropriate. If you're at stage 2, of a model that I use, which is stage 2 would be tired and wired, pacing and bouncing the boundaries may be appropriate. But it's much more at stage 3, at the reintegration phase, where you're at the point where you're basically improving. You can see your energy is increasing, or you've got a really solid baseline that you know that you can come back to that. And then with this bouncing the boundaries, what you're doing is gradually increasing what you do. Now, this is very difficult for most people because most people tend to have the achiever tendencies. So they start to feel a little bit better, they want to do loads more. It can often take a lot of discipline. So, for example, bounce the boundary on the first day, go back to the old baseline for day 2 and 3, then maybe on day 4 bounce it a little bit again. But it's incremental changes. Then when you get to the point of that incremental change, that becomes a new baseline, and you stay there for a while, then you then bounce the boundary again. So what you're doing is you're gradually and incrementally increasing what you're doing. One of the ways this is fundamentally different to pacing graded exercise is you are not dictating when you bounce the boundary based on a preset routine that you've been given. You're basing it on how you actually feel. One of my great frustrations with pacing is I understand the principle is to break people out boom and bust, something I absolutely agree with. The difficulty is that pacing still tends to stay as a mental activity. So you go from ignoring your body and pushing it all the time to still basically ignoring your body and using a mentally decided kind of routine that then you stick to whether you feel like it or not. And what we're really encouraging people to do is to really listen to their body. Because it's the not listening to the body which is often the reason why people have got sick in the first place. So intrinsic to all of this is having a baseline, really listening to your body, being disciplined enough to not go crazy and overpush yourself, and then to gradually bounce the boundary. To gradually see if you're able to do a little bit more, and also as you start to bounce the boundary, often patterns will come up around, what if I overdo it, what if I relapse, what if it's too much? Now you're going to have made sure that that's not the case, kind of, you know that intellectually, but the patterns are still running. So then you still want to work on those patterns using the various techniques if you're a patient clinic you already have learned. So how to calm the system down, stop those thought processes and that kind of thing. And then what you can effectively do is bounce the boundaries gradually, and then as you get stronger and as you recover more, and again I want to clarify, this is not the main secret to recovery, this is an add-on to doing physical treatments and psychology treatments that are getting to the point you can do it, but it's a great then vehicle to move forward. As you get to the point that you're stronger, you can bounce the boundaries a bit more aggressively. Because you know you've got a higher baseline, you've got more resilience, so if you overdo it, there's less of a price you're going to pay for it. To recap, remember, you've got to be at the point where your body's ready to be doing this. And if you're not clear about that, then if you're in treatment at the clinic, absolutely speak to your practitioner. One of the things they're fantastic at is helping you decide when to push, when not to push, when to bounce boundaries, when not to. So I hope you found this useful. Please do comment at the bottom underneath this video on the blog. There's a place to comment. If there's questions about this, post them there. I'll try and cover them in future video blogs. Thanks for watching. I look forward to speaking with you again next week.